Today's webinar is brought to you by the Rising Tide Mastermind. The Rising Tide Mastermind is a group of individuals that get together regularly to help each other not only with issues, but to help all of us get further faster in all areas of life. Whether this is the right group for you or it's another group, now more than ever, I think everybody needs a group of trusted advisors. Our presenter today is Heleen Grossman, CEO of HRTG Atlanta. Heleen is a senior human resources professional with over 30 years executive leadership experience. Her company, HRTG Atlanta, is an on-demand HR organization that helps companies handle and deal with HR issues while protecting them from risk. HRTG has a proactive, collaborative approach with your management and staff to obtain tangible results. Heleen is here with her business partners, Heather Steele and Cindy Durden. Together, they will present the best practices and important information concerning the Families First Coronavirus Response Act. Well, welcome everybody.
Welcome. Thank you, Trace. Hello, everyone, and we really appreciate your attendance today. And thank you again, Trace, for letting HRTG present this important information to everyone. We are hearing from our business partners that there is just a lot of information and a lot of legislature to absorb right now, and it's coming at us pretty much fast and furious. We've been asked to provide some help and guidance on how to work through some of these questions, the issues you may have, which are obviously affecting everyone's business. So today, our goal is to present some best practices as well as provide some clarity on the regulations that have currently come out. So with that, I am going to get started on our presentation. Let me start with some of the things you should be doing and you probably are doing at this point. Number one is you're following the CDC and other guidance that is provided, and there is enough of that coming out as well. Contingency planning. We know that you're doing that, thinking obviously about what the next month looks like, what the next 2 months looks like for your business, and thinking about the what ifs. What if this happens? And what if this happens? And what am I going to do? And we'll talk a little bit more about that. If you haven't, you should be looking at obviously establishing some work from home systems and policies. A big one for especially your remote team is communicating every day. Even if it is a quick check-in, even if it's a quick email to talk with your team, this is vitally important to stay connected. And obviously consulting with, if it's HR, it's legal, and your accounting and CPA, just based on all the regulations. To Trace's point, just to have a trusted advisor that can help bounce off some of the things that you may be thinking about and doing, that there is other folks who can help you through that. So things I'm sure you know you should be doing, but just really a quick summary of that. So for today, what we're going to be talking about is a couple of things. Number one, we're going to talk about keeping track of the expenses related to COVID-19. We're going to talk a little bit about some personnel items just to set the baseline and make sure that we're all on the same page when we use terms such as retain, layoff, furlough, exempt, non-exempt, because that will help determine, obviously, as your contingency planning in the future, how you manage those personnel. We will specifically talk about the legislation around Families First Coronavirus Response Act, which has two components, the Emergency Paid Sick Leave, as well as the Emergency FMLA Expansion Act. We will cover tax credits, exemptions, and then finally the health plan mandate, and we will end with several questions, obviously, that have come up that we would like to cover as well. So let me just start with keeping track. You know as well as I do, with all the legislation coming out, in particular, the last act, which just was signed on Friday night, which was the CARES Act, there's going to be a lot of government assistance that is going to be available to you and your companies. If you haven't already, consider adding an expense line item called COVID-19 and dump all the expenses that you have in there, including your staff, personal time spent dealing with this crisis, etc. It will be easier because there will be additional government assistance coming out for you to be able to grab those expenses and be able to apply it for government assistance very quickly. So you probably, again, are already doing this, but we just wanted to note that this is a best practice from our CPAs and accounting partners in terms of being able to help you get to those numbers very, very quickly so that you can apply for the government assistance that will be available. All right, so as you look at your personnel in your company, there are obviously two types of employees. There is exempt and there is non-exempt. Again, you may know this, but just to make sure we're all on the same page, an exempt employee is salaried. They must be paid regardless of the number of hours they work each week. If you have a salaried employee and they work 1 hour in one day, you still have to pay them for the week. That is the Fair Labor Standards Act. So no matter how many hours they work, if they work 65 hours in the week, or if they work 20 hours in the week, you have to pay them their salary for that week. If they're a non-exempt employee, hourly, then again, they are only paid for the hours that they are worked. So if they work 1 hour in one day, they only get paid for that 1 hour, okay? So it's important to understand the difference, especially as we move forward and we're looking at cash flow in terms of exempt and non-exempt. It's important to know the difference between the two. So in terms of personnel, obviously the number one question is you have to determine what personnel do you need for your business to operate. Secondly, with that in mind, who is continuing to come to the place of work and who can work from home? And so as you're looking at that, that's going to be also very, very important, especially if you haven't had people work from home in the past. You will need to establish some work from home guidelines and policies so that all people are on the same page when it comes to working at home, okay? And we do have samples of that as well. And then finally, as you're looking at your personnel, you're going to need to determine whether the personnel that you have currently at your business needs to be retained, laid off, or furloughed, okay? And obviously we get lots of questions around what the difference between those are. So with that, if you're laid off, or if you're intending to lay off any personnel, that is termination. It is a full separation from the company and they are not returning to work. Usually the benefits end once someone has been laid off or terminated, okay? A furlough, which you're gonna hear a lot around, is that it is a temporary unpaid leave. So you may decide that you would like to furlough your employees until May 1st, okay? That means you have every intention of bringing them back. This is just a temporary leave from work. The benefits can continue. You can still continue to provide benefits to your employees, okay? However, in either case, the employer has to file for unemployment because obviously it's a reduction in hours. So in speaking for Georgia, and I know many of you are not from Georgia, but for the state of Georgia, the employer will have to file for employment for the employee. You will have to follow whatever the stature is in your particular state in terms of the unemployment, but the reason is lack of work. And the good news is that the company will not be hit with any high unemployment rate the following year as a result of this. But again, remember, whether it's termination or whether it's furlough, the employee will be receiving unemployment benefits. And you do have to file that through the state. Now, there is a lot of questions as a side note around what is the unemployment rate going to be with the new CARES Act. And as of right now, we've got a dollar amount, but we're still looking for specifics in terms of how that will be applied. What we do know is that with unemployment, that it will be extended for an additional 13 weeks over and above what the current state standard is. And again, I'll just use for Georgia. Generally in Georgia, I believe it's 14 weeks of unemployment. So they're adding 13 weeks. So in Georgia, it is probably no less than 27 weeks of unemployment that an employee will be able to get. But more of that to come as we hear more about the CARES Act and the specifics around it. Again, that act just came out on Friday night. Today is Wednesday, and we are still working through all the specifics to get it out to all of you, our business partners, okay? But the point here being layoff or furlough, we need to file unemployment. All right, so jumping into legislation, as of right now, the legislation for COVID-19 has been in 3 parts, just so everyone knows. Part 1 took place immediately, and that was early March, I believe, and that has to do with testing and research and acquiring healthcare equipment. I believe it was $8.2 billion. So that has been in the works since early March. The second act, which we will talk about today, is the Families First Coronavirus Response Act that took place about 2 weeks ago. So today we will go into more specifics around that. And then part 3, which I just mentioned, which was the CARES Act, was signed last Friday night. And much of that is going to start to go into effect this week. Specifically, I believe the Payroll Protection Act and some of the unemployment, which we're working to get the details on. But again, for purposes of today, we're going to focus on part 2, the Families First Coronavirus Response Act. So what is this act and who is covered? This act covers any employer with fewer than 500 people, 500 employees, and it covers all nonprofit and profit entities. It takes effect today, April the 1st, and it closes on December the 31st. Now, does it mean that you have to take it today? No, it does not. Again, we have until December 31st to enact parts of this act, should you need to at your place of business. The first part of the act is the Emergency Paid Sick Leave Act, again, and this is for, again, employers with fewer than 500 employees. This refers to any employee, obviously, who is not working in your place of business, but they also cannot work at home or do any telework based on the following 6 reasons. And the government is very clear about these 6 reasons. It's either a government municipality isolation order, the person has been advised by a healthcare provider to self-quarantine. Number 3, they're seeking a medical diagnosis for symptoms of the COVID-19. Number 4 is they're caring for someone who is subject to quarantine and self-quarantine. Number 5, they're caring for children because the schools have been closed or a caregiver is unavailable. And then number 6 is really a catch-all. It's experiencing any conditions that may come out in the future from the Secretary of Health and Human Services that relate to COVID-19. So for the most part, most people will take advantage of 1 through 5, but they've added number 6 in there as a catch-all. This act does not apply to anyone who chooses not to come to work. So it has to be one of these reasons. This Emergency Paid Sick Leave Act is for 2 weeks of pay, and it is based on the reason. So should the employee be subject to either 1, 2, or 3, as you can see in the slide below, then they would get 80 hours of full pay if they're salaried or hourly for whatever their full pay is for the 2 weeks. However, the payment is capped at $511 per day. And as you can see, for 10 days of work or 2 weeks, it would be $5,110. So again, for this act, 2 weeks, okay? And this is the payment for that. Should the reasons be 4, 5, or 6, then again, the salaried employees would get 2/3 of their pay based on the number of hours, which is 80 hours for the 2 weeks. Hourly would get the number of hours worked on average over the 2-week period. Again, 2/3 pay. Payments are capped at $200 a day. And again, for the 10 days, that would be capped at $2,000. So I know a lot of information, but this is really for 2 weeks pay initially to cover any one of these 6 reasons, okay? This paid leave is in addition to whatever sick leave is already offered to the employer or offered by the employer, I'm sorry. As an employer, you cannot require them to use their other sick leave or their PTO before using this emergency paid sick leave. And if you need to, you can look at your leave program after this bill is enacted and take a look at what that, unpaid leave would look like for your particular company. Okay, and that is a policy that you may or may not have at this point, but that would be a good thing to take a look at in terms of a best practice moving forward, is that you do have an unpaid leave program. Okay, but again, this is for the first 2 weeks. What has kicked in after that is the Emergency FMLA Expansion Act. And this is for one reason and one reason only, and that is to care for a child under 18 if the child's school or place of care has been closed. So again, it applies to any employer with fewer than 500 people. Again, same reason, you cannot work at home, you can't telework because you've got the kids at home. And this particular act is up to 12 weeks of job protected leave. Now, many of you have asked the question, and we've heard it, and I'll just insert it right here, is a lot of people say, hey, I am under 50 employees, I don't even have an FMLA leave act. That doesn't matter in this case. This Emergency FMLA Expansion Act is for all businesses, whether or not you are under 50 or over 50, as long as you're under 500. However, the key here is out of the 12 weeks, there is no pay for the first 10 days. And the reason for that is that if you remember from the Sick Leave Act that I just covered, point number 5 was that if you had a child under 18, you would get Sick Leave Act. Well, here is the potential to cover this for those first 2 weeks. Then you have, after the 10 days, the same payment, which is 2/3 of the regular pay, again, capped at $200 a day and $10,000 total over those 12 weeks. But it's only for this reason. So again, unless there's other reasons, the other Sick Leave Act only covered that for 2 weeks. All right, so those are the 2 elements of the Family First Corona Response Act. What are the requirements around getting the sick leave? Well, the first thing is they need to request, the employee needs to complete a request form. And there's some basic information on that, and we at HRTG do have an example that we can send that makes it very easy for employees to complete that request form. Additionally, there is a Department of Labor poster that has been provided and must be displayed by today. And we have an example of that as well. You have to display the poster in a conspicuous place in your office. And if you've got folks that are working from home, you can simply email a copy of the poster and that satisfies the notice requirement. Okay. In terms of a payroll tax credit, this does apply to both the Emergency Paid Sick Leave as well as the FMLA Expansion Act. It is a dollar for dollar tax credit. The credit is only for the amount noted in the law, even though the employee may want to give more. And the reason we write that there is that, as you remember from the acts, especially in the FMLA Expansion Act, one of the minimal requirements is that if an employee qualifies for that, they're getting 2/3 pay. There may be a very generous employer out there who says, you know what, I'm going to give them 100% pay. I'm not going to give them 2/3 pay. I'm going to give them 100%. And that is wonderful and very generous. However, the tax credit can only be for 2/3 pay. So that's why that is noted in the law, that they have given a limit. And you as an employer can pay more, which is great, but your tax credit will only be for the amount noted in the law. And if there's a refund needed, then there's a credit form that the government will be able to provide you as well to be able to expedite that credit back to you. So again, dollar for dollar credit in terms of being able to provide these two acts to your employees. So in terms of exemptions, we've also heard about exemptions and can I be exempted. So the Department of Labor is empowered to exempt small businesses in certain circumstances. And again, we're hoping to get the paperwork on that if you feel that your business is possible to be exempted from these two mandates. However, I will tell you the biggest example is obviously a lot of restaurants at this point. You know, yes, they would love to be able to give their employees, you know, sick time. And yes, they would love to be able to give their employees FMLA, but doing that would absolutely shut them down. They may be part of an exemption as a result of doing these two acts. And so as a result of that, they may be able to exempt their business from providing the sick leave or the Family Medical Leave Act. Again, there's paperwork to substantiate that. There's some healthcare providers that may be involved in that as well. But again, more to come as soon as we see what the paperwork is and what you would have to do as a business to prove the hardship. But it is there. Lastly, the healthcare benefit mandate, which was part of all of this, simply says that all insured and self-funded medical plans covering the testing for COVID-19 will be reimbursed at 100% without any deductibles or any copays. And the mandate doesn't apply to treatment moving forward as needed, but at least for the testing and the diagnostic part of that, it will be covered at 100%. Okay. All right. So I went through a lot of information here. And so what we want to do is take a minute and go through a couple of some key questions that continue to come up to us. And for that, I am going to ask my assistants from my two business partner, Heather and Cindy. And I'm going to start with Heather and throw it over to you, which is the question that we get a lot is, am I entitled to take my employee's temperature before they start work for the day? Heather?
So yeah, Heleen, thank you. You definitely can take your employee's temperature before they start work. A recommendation is actually to ask them to self-monitor and take their own temperature before they even come into work or the office. And if they're at 100.4 or higher, that's the CDC level, that if they're above that, that they should self-quarantine and stay home. And if they come into your office and you do take their temperature, there's a couple of things around that also. One, you need to do it in a private place, one at a time, obviously. Don't write anything down, meaning you don't want to write down any kind of health-related information. You're simply taking a temperature, and if they are at 100.4 or higher, it is recommended that they go home until that temperature comes down without the aid of any kind of temperature-reducing drugs or medication. So the answer to the main question is yes, you are allowed to take people's temperatures.
Great. And then as a follow-up, Heather, can we require the employee to provide a doctor's note before the employee returns to work?
Yes, you can. The issue with that at the moment really is that doctors, as you can well know from watching the news and hearing everything and reading stuff on social media, is that they're swamped. So you can definitely ask for that. Most organizations that I've worked with really are taking, if that doctor verbally tells that person that no, you're not showing signs of COVID-19, you're actually showing signs of seasonal allergies that are hitting us right now too. Um, we are recommending you take that as B, because most people are hopefully using a teledoc situation, and they may not get an actual piece of paper showing yay or nay towards the COVID-19. But I will say most doctors are erring on the side of caution, and if they believe somebody might possibly have it, they are recommending they stay home. So you can ask for that, but just it would be hard to necessarily require it, because doctors just may not physically be able to provide it right now.
Great. All right, Trace, I think we have some more questions.
Sure, I've got a few here. Instead of layoffs or furloughs, can someone simply reduce the number of hours they're required for an employee to work?
The answer to that is yes, they can, but be very careful. One, you'll want to make sure that you give your employees an advance notice that their hours are going to be reduced and their pay is going to be reduced. Be consistent, and note that those folks that are subject to reduction in hours and pay can file for partial unemployment. So they will be eligible if their pay is being reduced and a reduction of hours is in place. They can file for partial unemployment.
What if they're a contract employee?
The same for a contractor as well.
Is it possible for an employer to change the exempt status during this time?
They can. Yes, they can. I would be careful about that as well, and make sure you take notes regarding that at any other time. You can do that. If you're moving somebody from exempt to non-exempt, remember that you're going to be paying them for any hours worked, and a lot of exempt employees have a hard time putting down the phone or checking emails, and you'll also have to put into place some time cards for these employees. So keep that in mind. Even for an exempt employee, you can reduce their hours. In fact, it's more of a reduction of pay and keeping them as an exempt employee. So there's lots of options out there. So I would, definitely take a look at that, and we could help you with exploring those different options as well before making any changes.
All right, so a new question. Does the business still need to provide emergency sick leave or expanded FMLA if layoff or furlough of employees occurs?
So this is Heather again. The answer to that is no. Once someone is on layoff or furloughed, they're eligible for unemployment. They aren't also eligible for the emergency sick leave or the expanded FMLA. You can't double dip, basically. However, if someone is currently on sick leave or currently using the expanded FMLA and you're paying them for that, you have to pay them for that up to the day you actually lay them off or put them on furlough. But after that, then they're eligible for filing for unemployment.
Do you have any extra information on unemployment or the additional $600 per week?
Yeah, as mentioned before, we are working toward getting an answer to that. It is the question of the day right now, because currently, and here's the question mark, and hopefully we'll have an answer, is that we know that the employee will be paid for an additional 13 weeks of unemployment. The question and the clarity that we're trying to get from the Department of Labor is that, and I'll just use again Georgia as an example, because it's a huge difference. So in Georgia, the average is probably, I'm going to use the number of $350 a week. The question is whether the additional 600 is on top of the 350, which means that the employee would get $950 a week, or is the 600 supplementing the 350, which means that they would get an additional 250 on their 350 to make it 600. So we are working toward getting clarity. And then the other question is the state paying the whole amount and getting reimbursed from the government, from the federal government? So there's still some questions. I think the good news across the board is no one's going to get less than what they normally would have gotten in unemployment in filing it. I mean, that's the good news. Nothing's going lower than that. It can only go higher and longer. So I think those are the two good pieces around the unemployment piece of the CARES Act that we'll have, that we'll hear more about here in the next couple of days.
A new question: if an employee is not coming to work because they're scared and it has nothing to do with COVID-19, do they receive benefits?
This is Cindy, and the answer is unfortunately no, they are not. Just because they have a fear and they decide to stay at home, the answer is no.
Does the FMLA Expansion Act apply to part-time employees as well?
Yes, actually does. This is Heather again. It does apply to part-time employees, but it's only the FMLA expansion portion. So if a part-time employee is having to stay home to take care of a child who is out of school and doesn't have any kind of care, then it applies to them at the moment. The rest of the FMLA policy does not apply to them. And the other issue there is that employers need to make sure that the people who are applying, they have to have worked for you for at least 30 days to be eligible for either part of the act, whether it's the sick pay and or the expanded FMLA.
If a company has less than 50 employees and they do not currently have FMLA, are those employers still obligated to pay the emergency sick leave and expanded FMLA?
This is Cindy, and yes, the answer is yes. And we covered earlier before, such as for restaurants, companies can file for an exemption from this if they're going to have an undue hardship, if it's going to affect their company and close their doors. So the answer is yes, but they can file for an exemption. As we spoke about earlier, there's paperwork that would need to be filled out, and they would have to prove the hardship.
And the last question I have: if an employee has already used up all their current FMLA allotment, are they allowed to take advantage of additional expanded FMLA?
So this question is an interesting one. So if you are mainly an employer that is 50 employees up to 500, so employers that have less than 50, the only FMLA that you're worrying about is the expanded FMLA, because otherwise your employees aren't eligible for the traditional FMLA. But for those with above 50 up to 500, if you have people who have been on FMLA, for instance, say you have an employee who more than 12 weeks ago had a child, and they took their full 12 weeks to be out on FMLA to bond with their child, they are now not eligible for this expanded FMLA. It is not going to be a total of 24 weeks that they are eligible for. It's still only 12. So unless they've gained some of those 12 weeks back, if they've used them within the last 12 months, or the other way is if you reset your FMLA every year on, say, January 1st or whenever it is, and then they have their new allotment, it's whatever they have left over, if they've already used FMLA, that they can use now on the expanded FMLA. If they haven't used anything, well, then they get the full 12 weeks as far as the expanded FMLA is used. The other thing that I have asked a couple of questions about with this is we're approaching the end of the school year. And so as schools either maybe reopen before the end of the year, or it goes into the end of the school year and now we're in the summer months, you need to keep asking people for documentation showing that the care is not there. Because you as an employer have to keep a hold of all of this information, the reasons why people are one, asking for and getting paid for the sick leave and or the expanded FMLA, because using that documentation is how you're going to get the credit back from the government. So don't assume that when somebody asks for expanded that it's just, oh, well, they're out for the full 12 weeks. They do need to keep providing that as things change throughout what's happening. And as we all know, this is definitely a fluid time in our lives with every day new information's coming out. So just be aware of that.
Yeah.
Well, Heleen, Cindy, Heather, I really want to thank you for shedding some light on this. I know it just came out this past Friday. I can't imagine what your lives have been like the last couple of days trying to decipher all of this. So I'm sure there are people that have more questions. And for those of us that are members of the Rising Tide Mastermind, I know we're getting ready to go into a session where we're going to ask personal questions to each of you. But if somebody wants to find out more information and they need your help, what should they do?
Yes. So what I'll do is we will send you our email and they can reach out to us. They can also go to our website, which is www.HRTGAtlanta.com. There is a space there where you can submit your name and your question, and we will get back to you as well.
Well, again, thank you so much for coming and doing this webinar. I know we helped a lot of people today.
Thank you. And thank you for
Thank you,
including us.
Trace.
Appreciate it.